Welcome, everybody. It's a real pleasure to be here today. This is our 11th annual scientific meeting of the NHS Research Scotland Mental Health Network. And it's our first annual scientific meeting that's being delivered online. So it really is a great pleasure that we're now live and we're now broadcasting. And we've got over 230 people registered for the meeting today. It's been a long journey, to be sure. We start planning this meeting in January of this year, and our plans were developing very nicely, and then March arrived, and of course everybody has been severely disrupted since March in dealing with and coping with the pandemic. And we are just so pleased that we were able to deliver and bring the annual scientific meeting to you today. So thank you very, very much for joining us and coming along with us today. You'll just see at the bottom right-hand side of the slide, you'll see our hashtag for tweeting. In the background, we'll be tweeting throughout the day. We'll be using hashtag NRSMH20. So any tweets, please hashtag us in so that we can kind of pick that up and monitor that through the day. First thing, a couple of things to just go through before we get started. All our plenary sessions and all our parallel sessions are being recorded. That includes the chat as well. And we're going to make those available on our website after the event, and you can review those and look at those at your leisure and download those and share those. So we're very pleased about that. I also wanted to kind of point out our web address, which is www.nhsresearchscotland.org.uk/research-areas/mental-health. And if you go to this web page and you click on training and events, you'll be able to find all the details of today's meeting, including, very importantly, our evaluation form. And you can download this on Word and you can complete this. We would really, really greatly appreciate if you're able to send us your evaluation. And you can send that to our administrator Lisa Martin. Her email address is there for you, lisa.y.martin@ed.ac.uk. So we greatly appreciate your feedback through the day. We're running this online for the first time, as I've said already, and we have had a great deal of uncertainty about that. And we've got to know and got to love the Hop-In platform. It seems to be working fine. It seems to provide a sort of nice conference type space, but we're quite aware that some of you may have technical difficulties during the day. And if you do have any difficulties, then if you email info@smhrn.org.uk, we'll be monitoring that email address all day, and we will reply to you if you're having any difficulties at all. Okay, so next step for me is just to introduce you a little bit to the Hop-In platform. This is our guidance document. You can kind of download this, but this really tries to show you the kind of key features of the Hop-In platform. So the first thing to notice is at number 1 here. This is your account menu, and we'd encourage you to update your account there and update your profile there so that you can share details about yourself with others. This is your people menu, and this is where you can see delegates who are attending today. And if you click on an individual's profile, you have the option to make contact with them. So hopefully this allows you to kind of move through the conference, meet people and catch up with people, old friends and new friends and colleagues. Number 3 here, this is pointing to the chat tab, and this chat tab accesses the event channel for announcements. So on the stage channel, you can ask questions of plenary speakers, and you can also use this chat tab within the parallel sessions as well. This tab minimizes your sidebar if you need to. And this tab number 5, this is the stage area where you are now. This is where all the plenary sessions will take place today. And when the plenary session has started, what you'll see is a red live icon, and you can then drop in and see the speaker and hear the talk. This tab here at number 6 shows you our sessions, and this is where the parallel sessions are going to take place today, and it's also where the poster sessions are going to take place. And again, when those sessions are live, you'll see a red icon with now lit up. Here's our networking tab, and networking area. If you go into the networking area and you want to kind of network with other people here, you can press the ready button, and this will then randomly link you with another delegate with who you can have a kind of 3-minute conversation with. You can choose to share your contact details, and networking is going to be available throughout the breaks, and when the networking area is open, that will be again highlighted with the red now icon. And then we've got the expo area, and this area again is where you can visit our exhibitors and find out about what they're doing. And again, when the expo area is on, you'll see that kind of red on. And just finally, and an important thing to show you today is that this is the polls function. And as our delegates for the ASM, it's now become tradition that delegates have an important job to do, and that is to vote for your People's Choice poster. And this is where you can vote. We have 2 People's Choice Awards this year. So we've got a poster session in the morning, and we've got a poster session in the afternoon. And in each of those poster sessions, you can pull your favorite poster, and that will be available for us in the backstage area to see, and we can then make an award for the People's Choice poster. So that, again, as I said, there's an award for the morning and there's an award for the afternoon. And we have 2 other awards today for posters, which is the best student poster and then the best poster. So before I go any further, I've said it's been a long journey to today in terms of our planning and organization and our commitment to delivering an online event. And there are some very important acknowledgements for me to make. Catherine Death and Donald McIntyre have really taken hold of the Hop-In system and have really sort of got to understand it, got to know it, and really helped organize at the backstage throughout the day. And Catherine, I know, has been meeting with poster presenters and has been meeting with speakers, plenary speakers, and also workshop or parallel session organizers, just to take everybody through and acquaint them with the Hop-In system. Lisa Martin, to thank Lisa, who's just done an absolutely outstanding job again in helping to organize the event and take registrations, organizing posters, and keeping us communicating throughout the day. Louise Beattie, Catherine O'Hare and Kimberly Atkinson are also helping in the backstage area today and helping things run smoothly, keeping an eye on Twitter, keeping an eye on the front stage area, and helping throughout the day. And also sincere thanks to Michael Smith, Justin Williams, and Ashley Duthie, who are chairing our sessions today and have also helped us with judging the posters as well. So thank you very much. And we really appreciate the commitment of the whole group throughout the year in terms of making the event happen today. I'm really delighted to announce what I think is an exciting program, and we've got 4 plenary speakers. And after this, we've got Professor Chris Hollis, who's speaking on youth mental health in the digital world and understanding the risks and harnessing opportunities. And that's going to be chaired by Ashley Duthie. We've then got Professor Matthew Smith from the University of Strathclyde, whose talk is entitled Peace of Mind, Social Psychiatry, Universal Basic Income and the Prevention of Mental Illness. And that's chaired by Dr. Michael Smith. Professor Daniel Smith is speaking on schools-based mental health, and that's chaired by Justin Williams. And Professor Ines Mayen-Gourmez is joining us from the University of Leuven in Belgium and is speaking on digital health and asking the question is whether it can bring true person-centered care to psychiatry. And our chair for that is Donald McIntyre. I'm also excited by our parallel sessions today as well. So we have two parallel sessions. Our parallel sessions are led by Breda Cullen, which is on data science and mental health, looking at the opportunities and challenges for that. And she's joined by Heather Wally, Mark Adams, Sam Layton, Michael Fleming, and Sue Fletcher-Watson. And Susie Sirrett is a member of our network. She's a peer researcher, and she's going to lead a parallel session on involving people with lived experience in mental health research. And she'll be joined by George McMeekin, Gordon Johnson, Neil Quinn, and Steph Allen. Some of you might remember last year at our ASM last year, one of the things that we did was we made a commitment to developing a research and policy forum. And what we wanted to do in that research and policy forum was really bring together researchers and policymakers that we could increase the impact and knowledge exchange of research conducted in Scotland and beyond Scotland to improve and support policy-making decisions. And we started that work in November last year, straight after the ASM, and we worked together to develop that. And then, of course, the COVID pandemic hit us in March. And the work of that group was really transformed to the COVID-19 Mental Health Research Advisory Group. And that group has been meeting since April of this year. In my role as interim director of the Mental Health Network, I chair that group, but that group is made up of a number of academics from Scottish universities, clinicians, policymakers, and also people with lived experience who have really helped bring together a group with diverse views and experiences and expertise to help translate the emerging findings that are coming from mental health COVID research into advice for government. And that's been our main function and a key task over the last 7 or 8 months. We've used the COVID-19 living map of the evidence, and this is hosted by the Evidence for Policy and Practice Information and Coordination Centre. And this coordinates and collates all evidence on COVID research generally and mental health research specifically. And you can see here since March, the number of mental health COVID studies has increased steadily. And of course, this presents an important challenge to how do you synthesize such evidence on a kind of timely and prompt and transparent basis. Our research advisory group has undertaken a number of activities. So early on in April, May, and June of this year, we published a number of COVID-19 mental health surveillance reports. These were drawn from ongoing survey data, including the ONS data, but also from new research publications. And these helped us track early on the signals that are emerging from data and from research on the mental health impacts of COVID. These data really showed us the increase in anxiety levels across the UK, and that although those anxiety levels peaked and dropped a bit after April, they still remained stable but high over the lockdown period. It was apparent that these impacts were not evenly distributed. Certainly we were seeing evidence of those impacts having a greater impact on people, for example, people living with a long-term condition and people living in poverty and deprivation. And it was very clear and early, it was important to understand these differential impacts on different population groups and how these might shift over time. And although the evidence base was very incomplete at that time, it was important that we were monitoring this to inform the need for whole population approaches, as well as supporting at-risk groups. We also, with the leadership and support of Public Health Scotland, conducted a rapid review of COVID-19 impacts on mental health, and we asked 3 questions. At that stage, what was the impact of the COVID-19 pandemic on mental health outcomes using validated measures at a population level? What were the risk and protective factors that were associated with these mental health outcomes during the COVID pandemic? And what were the key learnings and implications for Scotland? We used the COVID-19 living map of the evidence as the search strategy for the rapid review. We reviewed dates from the 4th of March through to the 15th of May. And we also expanded the search available on the living map of the evidence to also include PsycInfo and to also include pre-publication based databases, medRxiv and PsyArchive. And we found a total of 51 studies that were included. At that stage, and this was published in June or July this year, there were significant methodological challenges in the evidence, particularly on representative samples, different outcomes measured using different measures, using different thresholds. Many cases, the studies were not well described or transparently reported, and these limitations did mean it was difficult to draw clear conclusions. However, it was likely, and it was clear that there was likely to be an increase in poor mental health in Scotland, that the distribution of this impact was likely to reflect those existing disparities and inequalities that have been long-standing in Scotland. And a number of key groups were identified as being at higher risk of those adverse outcomes, including frontline NHS and social care staff, women, children and young people, and those individuals with less access to educational opportunities and those living with existing or pre-existing mental health conditions. There was also evidence of protective factors, and these are protective factors that are known to be protective more generally in terms of good mental health. The third and important piece of work that was commissioned was the Scottish COVID-19 Mental Health Tracker Study. This report has now been published on the Scottish Government's website and is part of a larger study that was published in the British Journal of Psychiatry a couple of weeks ago now by Rory O'Connor and colleagues. And these data were based on a representative, nationally representative population of around 2,500 adults. These data were taken between the 28th of May and the 21st of June this year. And what we could see from these data were those impacts in terms of anxiety and depression being greater in young people, being greater in those groups more exposed to poverty and deprivation, those with pre-existing mental health problems, women and also people of colour. In terms of suicidal thoughts, we saw a similar pattern of findings with impacts being greater in young people aged 18 to 29, those in living in poverty or deprivation, those with pre-existing mental health problems, and also people of colour. So these findings and the discussions that have happened within the research advisory group have really helped provide advice to government to help them make decisions about their plans for transition and recovery of mental health services. I think it's important to note as well during this time the call from the Chief Scientist's Office, and this was the rapid research call that was called very soon after the outbreak of the pandemic. And after that call, 10 mental health studies were funded, and this was across 7 academic institutions in Scotland, and over £850,000 of monies awarded. These were studies that were commissioned to be delivered over the first 6 months, and we're really looking forward to the results of those studies coming through. I think finally what I wanted to say also is one of the things that happened very quickly at the beginning of the pandemic was that research shut down very, very quickly, except, of course, for COVID-19 research. And one of the things that has been a real and significant challenge has been the opening up of research again. And we're working closely with the Chief Scientist's Office and with the NHS Research Scotland Restart Advisory Board to try and promote and get research restarted again. The NRS Mental Health Network is committed to starting mental health research, and we're working with our researchers and academics to get research going. And we're really looking forward to research studies being up and running and recruiting for those studies. And that will take a lot of collaboration across academics, but R&D departments and also clinicians on the ground, because services are still coming back as well. An important part of our work has also been, and our commitment last year was to develop a public and patient and public involvement strategy, and we've worked very hard on doing that, and I'm really looking forward to hearing Susie Sira talk about that work and where we've got to, and we really hope that that's going to be a resource to researchers in Scotland in terms of supporting their patient and public involvement in research. Okay, so this is just a slide to remind you that this is the web address that you can click on to access your evaluation form for the day. We'd really appreciate that you send that evaluation form back to Lisa Martin so that we can use that to help think about and plan our future events and future online events as well, hopefully. If you have any difficulties, do get in contact with us. This email address is being monitored throughout the day, and we'll keep an eye on that and we'll respond to you as soon as possible. And the final thing for me to say is just to say thank you very much for joining us today. It's a really important day for us in our calendar. We really hope that you find the day enjoyable, that you find it interesting and stimulating, but also that you find it sociable as well, and that you have the opportunity to meet up with colleagues old and new, and that you take a lot from today's meeting. So thank you very much, and just have an excellent day.